November of 2018, I was due for my mammogram, my annual mammogram, and I had let it slide because my mother-in-law was very ill, and I noticed that I had a little discomfort on my right breast, but I just thought, okay, I'm stressed. This is probably a cyst from stress. And so I guess it was February when I noticed that I had a little indentation around my nipple, and I thought, oh my gosh, I've got to get in and get this checked. So I went in, got my mammogram, and I knew immediately, because I could kind of see from the corner of my eye that there was a shadow there. And then when we did the ultrasound, I told the technician, I said, it's cancer. And she said, well, let's get the radiologist in. And the radiologist said, yes, it's cancer. And so that started the process. And so after I got my port in, I had my chemotherapy started in April and went through the end of July. And right before the end of my last treatment, I went in to see Dr. Thompson and Dr. Marisevich. And I had never met them before, but they both were so genuinely kind and caring, very, very caring. And my husband went with me to see Dr. Marisevich to talk about our options. And he discussed all the different options from implants to what they call a deep flap, which is an autologous transfer of your own tissue to rebuild your breast area. I have an autoimmune disease, and I thought the safest thing for me is let's do the autologous, because if we do implants, my body might decide to reject them later, and so let's just do this. And so I made my decision, and Dr. Marisevich told me, described the entire process.
The deep flap or DIP flap is a great option for patients that want to reconstruct their breasts with their own tissue. In other words, we transfer tissue from the tummy to the chest wall to create the new breast. One of the main advantages of this procedure is that you have your own tissue used to reconstruct your breast, and also there are some benefits to the donor site where you can get the results of a tummy tuck procedure.
Anyway, after seeing Dr. Marisevich, I was really excited about the process, that I could have everything rebuilt and it would be my own tissue, and it would, it'd be something that once it was done, it was done. Most amazing thing, they were able to do both the mastectomy and the reconstruction all at the same time. And they've done enough of these surgeries that they have their routine down, and they know what to do and when to do it, and so they're synchronized rather than one doctor just coming in and working in his own silo, but they're synchronized with each other. And you hear of people who have such poor results, and of course I'm always left with the question, why? There's no need for that. Come to Baylor. They know how to do this. There's just no need to have be left with major scars and feeling like you're not yourself. And I feel like myself, actually a better version of myself. I know you hear people say that, but it's true. I'm a better, especially at this age, I'm a much better version of myself. I couldn't have asked for better results.